Greetings, fellow humans. Katrina here. Quick disclaimer, I am a licensed professional counselor, not your counselor. Anything I'm about to say is to be taken for education and amusement purposes only. Disclaimer over. So today I thought I'd talk about what I don't know about borderline personality disorder, but I thought we'd take a deep dive into the DSM-5 and take a look at what some of the diagnostic criteria actually is. And so I want to preface this by saying, just because you identify with one or more of these does not mean you have this particular personality type. If you relate to more than 5, you might ask your therapist about it. And I'll just read from what it says in the beginning of the criteria: a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity beginning in early adulthood and present in a variety of contexts, as indicated by 5 or more of the following. And so these 9 criteria have some big words, and I might break them down a little bit, but for the most part, they're self-explanatory. Number 1 says frantic efforts to avoid real or imagined abandonment. That real or imagined is important because somebody might have a loving and supportive family that's always there for them and feel alone or being left. So number 2 says a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. So idealization is where you put somebody up on a pedestal. They can do no wrong. They're the most wonderful person in the whole world. And then devaluation can occur even with somebody formerly idolized. And that's where you completely write somebody off. I want nothing to do with you. You did one small slight or perceived slight, and now I will completely write you off forever, and you're useless. That's devaluation. Number 3, identity disturbance. Markedly and persistently unstable self-image or sense of self. Number 4, impulsivity in at least 2 areas that are potentially self-damaging. Now, this can be anything like spending, sex, substance abuse, reckless driving, or even binge eating. Number 5 says recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. That can be cutting, burning, scraping, punching walls, things that hurt the body. Number 6, affective instability due to marked reactivity of mood. So, for example, this can be intense episodic dysphoria, it can be irritability, or anxiety, usually lasting a few hours and only rarely more than a few days. Number 7 says chronic feelings of emptiness. And if you've never felt empty, that can be a hard one to conceptualize, but there is a feeling of numb. So, of course, there's also some feelings of emptiness. And just because you felt emptiness at a time or two, again, doesn't mean that you have this particular personality type. Number 8, inappropriate, intense anger or difficulty controlling anger. So, for example, that could be frequent displays of temper, constant anger, or recurrent physical fights. The last one, number 9, says transient stress-related paranoid ideation, so paranoid thoughts, or severe dissociative symptoms. So dissociative symptoms are where we feel separated from our body in some type of way. And then there are different diagnostic features in the DSM to be considered, as well as associative features supporting that diagnosis. I won't get really into those, but I will mention the prevalence. So the prevalence, that just means the median, or like how much of the population have BPD, is estimated to be about 1.6, but maybe as high as 5.9%. And it says the prevalence of BPD is about 6% in primary care settings, about 10% among individuals seen in an outpatient mental health clinic, and about 20% among psychiatric inpatients. the prevalence of borderline personality disorder may decrease in older age groups. I'm not really sure why that is. And these numbers may be off because this book was written, well, not written, but published May 2013. So we're coming up on, or that's about 8 years ago, I would say. So definitely the numbers may have changed. I don't know whether that means there's more or less people with borderline personality disorder, but I do know that there are some arguments to rename it, as the term borderline is pretty outdated and goes back several DSMs. So in the differential diagnosis, it does make sure to rule out any depressive and bipolar disorders. It does often co-occur, though. You want to rule out any other personality disorders or personality change due to another medical condition, as well as substance abuse disorders. And then lastly, it does say identity problems. BPD should be distinguished from an identity problem, which is reserved for identity concerns related to a developmental phase and does not qualify as a mental disorder. So if you think about a young teenager experiencing a lot of these symptoms, they may be going through an identity crisis, not crisis, a developmental phase of their identity. Yes. And that can occur through adolescence. I've heard that adolescence isn't just till 18. No. Adolescence goes all the way till, I want to say, 26 or 27, something like that. And so in the developmental phases of our brain and body, then we may also experience identity problems. So that's perfectly normal. The key thing in the beginning that I want to go back to is that it says a pervasive pattern. Pervasive pattern is a key component. You might experience some of these things at a moment in time and not ever for the rest of your life. So that doesn't mean you have BPD. Now, if you do have borderline personality disorder, some of the things that aren't mentioned in the DSM-5 criteria are the more positive aspects of having that personality type. And the reason I switch between saying disorder and type is because sometimes through treatment, people originally diagnosed with BPD, with the appropriate treatments, they may not eventually meet criteria for all of the symptoms, or they might sometimes do and sometimes not. But personality types aren't always necessarily problematic. And so some of the good things about BPD are people are extremely resilient. So somebody who may have gone through so much and still be able to maintain a full-time job or still be able to take care of their children. So there's an extreme amount of resiliency as well as doing the best that they can. So that's an important assumption I learned from Marsha Linehan. She has some assumptions about treating people with borderline in therapy. And that is the first assumption in her book, actually, is that patients are doing the best they can. Another from Marsha Linehan's cognitive, it's from her 90s book, Cognitive Behavioral Treatment of Borderline Personality Disorder. It's where she talks a lot about how she developed dialectical behavioral therapy. And her second assumption in there says patients want to improve. So there may be behaviors that some therapists think contradict that. They might say that there's a resistant client, but that's not the case. That's not the assumptions in treating borderline that are helpful. Another helpful assumption might be patients need to do better, try harder, and be more motivated to change. So that might sound like it contradicts the first two, but it really doesn't. But it doesn't necessarily mean that there's, I lost my train of thought on that. Oh, well, I'll go on to the next assumption. The next assumption is that patients may not have caused all of their own problems, but they have to solve them anyway. That is part of taking our personal responsibility. It does stink that things happen to us, but if we fall down into a pothole, it's our responsibility to climb out of that hole. And so a fifth assumption she mentions is the lives of suicidal borderline individuals are unbearable as they are currently being lived. That means they are ready for change. Their experiences are valid, and they may very well be living in hell. A sixth assumption she mentions in her book is patients must learn new behaviors in all relevant contexts. In a strict DBT, dialectical behavioral therapy setting, there is a skill building class. It's basically a very educational thing to teach things like distress tolerance, mindfulness, interpersonal skills, and emotional regulation. The seventh assumption she mentions is patients cannot fail in therapy. Let that sink in, because that pretty much contradicts the assumptions of a lot of therapists that when patients drop out or fail to improve, that it can be attributed to a deficit in their motivation. Even if that was true, though, the job of therapy is to enhance motivation sufficiently for patients to progress. So I would say that's not a failure on the patient or client or participant's part. That would be a lack of skill for the therapist on their end. The last one, Marsha Linehan mentions in a treatment overview in her book, is that assumption of therapists treating borderline patients need support. Okay, so some therapists get caught between the demands for immediate relief and long-term cure, and many other factors make it really difficult for therapists to stay therapeutic with people with BPD when their own emotions are being triggered in some type of way. So whether it's a group, treatment team, consultant, or a supervisor, or just your own therapist, something to really keep therapists on track can be quite helpful. So that was a bit of an overview from the DSM-5 of the diagnostic criteria, as well as some of the assumptions that Marsha Linehan puts into her work using dialectical behavioral therapy techniques. And this is a subject that is extremely interesting to me because there are, I want to say, like 10 different personality disorders in the DSM-5, but for some reason, borderline to me is just the most interesting. And so that's why I thought it would be interesting to talk about today. I hope this was amusing and potentially educational. Remember, nothing I've said on here is to be taken in any way diagnostic or advice or anything like that. I'm a professional, but not your professional. If you want to support the show, go ahead and Cash App Katrina Dragon, or on my website, you can click the button to support the show. And I do appreciate each and every one of you simply for existing.